Have you ever gone to the doctor for some kind of ache or pain and wondered, what are they actually doing? What are they looking for? Well, today we're going to pull back the curtain on that whole process. Let's break down the musculoskeletal assessment. It helps to think of your body as this incredible, intricate machine. Your musculoskeletal system is pretty much the chassis and the engine all in one. You've got the scaffolding of bones giving you structure, and then the engine of muscles that powers every single thing you do. It's really a beautiful partnership. So what happens when that machine starts to, creak a little bit, or grind, or just plain hurt? How do you figure out what's wrong with it? Well, that is exactly where the assessment comes in. It's basically a systematic checkup to find out what's really going on under the hood. Okay, so to really get what the checkup is all about, we got to quickly understand the parts being checked. So let's just take a quick peek at the two fundamental components that let us stand up, walk around, and just live our lives. It's a two-part system, right? On one side, you have your skeleton. That's your internal framework, giving you support and protecting all the important bits. And on the other, you've got the muscles, these powerful, flexible tissues that pull on those bones to make you move. They absolutely have to work together perfectly. So a musculoskeletal assessment is really just a deep dive into how well all these parts are working. It's about checking how your joints are moving, how strong your muscles feel, and just the general health of the whole system. And it becomes absolutely crucial when someone comes in saying, hey, this hurts, or I just can't move like I used to. Honestly, the best way to think about this whole thing is like a detective story. Your healthcare provider, they're the detective, and your body is holding all the clues. But the first step isn't a physical test at all. It's just a conversation. Before any poking or prodding, it all starts with the talk. This is where the detective gathers all the background info. Your health history, your story. It provides this essential context that they'll need to make sense of the physical clues later on. Seriously, your story matters a ton. And you can expect questions just like these. Any old injuries, they can have effects years later. Does a certain condition run in your family? That could be a clue. Even your workout routine could be the culprit. And of course, getting really specific about the pain, like when it started, what makes it worse, that helps the detective narrow down the list of suspects. Okay, once the story is established, the hands-on investigation can finally begin. And we can break this whole part down into 3 simple, really logical steps. Look, feel, and move. Let's see how the detective builds their case. So the detective work kicks off with just observation. It's amazing what a provider can pick up on just by watching you stand there or seeing how you walk across the room. Your posture, your gait, if you're limping or protecting one side, it all tells a story. And this is a perfect example of what they're looking for. A nice aligned posture is the baseline, but any deviation from that, like the hunchback we call kyphosis, or that inward curve of the lower back, lordosis, those are immediate red flags for potential issues with the spine. Then the inspection gets a little more zoomed in, right on the area that's bothering you. They're scanning for any visible signs that something's off, and the most obvious clue could be something like bruising, which points to some kind of trauma. They'll also be on the lookout for any obvious deformities, things that clearly change the normal shape of a body part. A bunion on the foot is a classic example. It's a real structural change at the joint. And finally, a huge one they look for is asymmetry. Is one shoulder sitting higher than the other? Is one ankle way puffier than the other one? That kind of swelling, or any difference between the left and right side of the body, is a really significant clue. So after looking comes feeling. This is called palpation. The provider will use gentle pressure on your muscles and joints. And they're not just poking around randomly. They're searching for specific feedback. Things like unusual heat, which can signal inflammation, or trying to pinpoint the exact spot where it's tender or painful. All right, the final big step is to move. This is all about testing your range of motion, or ROM. First up is active ROM. That's where you move the joint all by yourself. It shows what your muscles are capable of. Then there's passive ROM, where the provider moves it for you. And here's the key. If they can move it further than you can, that might point to muscle weakness, not a joint problem. That difference is a huge diagnostic clue. So really, the whole point of all these movement tests is just to see if your joints can go through all their normal motions smoothly. What you're hoping for is movement that's free, without any stiffness or swelling or pain. Anything less than that helps the detective get one step closer to solving the case. And now it's time to put it all together. This is the part of the investigation where all those clues, from the talk, the look, the feel, and the move, start to come together to form a really clear picture of what's going on. For instance, let's circle back to the look. A provider might notice that a patient's shoulders aren't level or their hips are uneven. These are classic external signs, and they're often big indicators of something like scoliosis. And this is where it gets really powerful because that observation can then be confirmed. An x-ray might be ordered to see what's happening beneath the surface. And just look at that. The visual clue of the uneven shoulders perfectly matches the S-curve of the spine on the x-ray. The outside clue matched the inside reality. Case closed. Now, in some cases, especially after an injury, the assessment has to go a little deeper to check on nerve and blood vessel function. This is a super important safety check, and it's known as the 6 Ps. They check for severe pain, pallor, which is paleness, the presence of pulses, paralysis or the inability to move, paresthesias, which is that pins and needles feeling, and poikilothermia, which is just a fancy way of saying the skin is cold to the touch. It's a critical checklist to rule out any emergencies. So the assessment's done, and a diagnosis is taking shape. The investigation is pretty much over. So, what's next? Well, now the focus shifts from finding the problem to actually fixing it. It's time to make a game plan. For a ton of common injuries, the immediate action plan is simple and super memorable. You've probably heard of it, the RICE method. You just rest the injured part, apply ice to bring down swelling, use compression for support, and elevate the limb. It's a really powerful first aid tool you can even use at home. And that's our look inside the musculoskeletal assessment. It's this pretty amazing process of detective work that helps us decode the signals our bodies are constantly sending us. Which leaves us with one final thought. Now that you know all this, what's one thing you'll pay a little more attention to the next time you move?